Dr. Wayne Dyer.
Hello, everybody, and thanks for joining the show today. Excuses Be Gone with Dr. Wayne Dyer. And I'm Diane Ray, answering the phones here in beautiful Carlsbad, California. Dr. Wayne Dyer is joining us in Maui. And Joe just opened the phones, so the callers are rolling in. If you'd like to join the show and talk to Dr. Wayne Dyer today, 866-254-1579. That's toll free in the U.S. or Canada. Also 760-918-4300. If you're outside the U.S., then just dial your country code. And Dr. Dyer, how are you? How are things going?
I am great.
You seem in a good mood today. I'm getting some good energy.
Well, I'll tell you something that happened. I'll tell you what happened. It's a strange thing. I spoke for the Parker Chiropractic Group in Las Vegas in January. There were about, I think 4,000 or 5,000 chiropractors there, and I was keynoting the talk. And a guy came up to me. His name was Lance Rawlings. When I was just walking through I don't know if you've been in Vegas.
Sure.
The hotels, you have to, you can never find the lobby. You can never find anything. You just have to, all you do is just run through darkened places that have just more machines in them. They got it organized so that you're in a trap, whatever. But anyways, walking around trying to find my way out of the hotel. And this fellow came up from Utah. His name was Lance. And he said, and I had talked about something called ART, active release treatment, or technique, which is a way of taking the pressure when you have back injuries or leg injuries or chiropractic, whatever it is. It's not cracking of bones and so on. It's much more stretching and taking the pressure off of the places where the nerve endings are causing you the pain. And I've been doing that. And I talked a little bit about that in my talk and how much it had meant to me. And I have a practitioner of ART here. This guy named Lance, he said, well, there's something called CRT, which is cranial release technique. And he said, it takes me 2 minutes. I'd like to demonstrate it on you. I'm very open to all of those things. I've always said I have a mind that's open to everything and attached to nothing. Although if he was going to put leeches on me, I would say, no, I don't think I need to be bled today. But at any rate, he did this technique. He came up to my room, and I was there with my friend, and both of us had this technique done where they do a sort of a muscle test, and they push you, and you lose your balance, and then he sees if you can strengthen you by looking at the cranial nerves in the head. That's something like 80% of the nerves in our body come from in the cranium. And he did this stretching thing on my neck and all of that, and he had been specially trained in it. It's called CRT, cranial release technique. And so I was seeing my chiropractor here on Maui, Rich Sargent, and I told Rich about it, and he wanted to go to the training. So he paid the money and went there and spent all last week in Phoenix, Arizona, getting this treatment or training on how to do this CRT, which is really stretching the nerves and reacting to the cranial. And he did a muscle test on me, and he was able to push me over very easily. Then he did this technique, and I remembered when I had it done in Vegas, when it was over, I just felt so light and so good and so happy and so peaceful. And Rich did it to me this morning he had just got back. I just decided I wanted to go over there and be his first patient back after he got back from this week-long training. And it was just absolutely amazing. I feel absolutely phenomenal. And it takes about 2.5 minutes. And it just sort of readjusts the cranial nerves in some way. So that, and then when he tried to push me over doing the muscle test, the same one that he had done 2 minutes before, he couldn't budge me.
But this isn't cranial sacral. I've heard of that.
No.
That's different.
No, I have a cranial sacral therapist too. I have this lady who does that. Her name is Kate, and she comes over here to Maui once in a while, and we'll spend like 3 or 4 days doing it. Now that's a very different thing altogether. That's sort of a mental thing and reading of energy and so on. This is where you actually take the cranial nerves in the head and readjust them because they're out of balance and causing even pains in your back and in your knee and so on. And so anyway, he did that with me this morning, and I'm thinking about taking the training myself and learning how to do it. But anyway, I just felt phenomenal, and I just came over to do my radio show with my CRT. So those of you want to look it up and find somebody in your area. I know the fellow in Utah, Lance Rawlings, has practiced it. He convinced me because when someone shows you something and shows you with a muscle test that you're in balance and then you're out of balance, and you just see the physical reaction, and also because he asked me when I was walking around the room, he said to my friend Kerry, he said, I'm going to ask him how he feels, and he's going to say he feels lighter. And sure enough, I didn't know he had said that. He came and he said, so how do you feel? I said, I just feel so light. It just almost like I was floating, and that's how I'm feeling this morning.
Wow, that sounds amazing. CRT is
Yeah.
cranial release therapy?
Cranial release technique.
Technique,
Yeah.
okay.
Yeah, and they have training for it, and actually anyone can get the training. You can get a chiropractor, you can be a nurse, an RN, you can be a massage therapist. Anyone in the healing professions can take it. It's fairly expensive training. It takes 1 full week. I don't know too much more about it other than I'm just
Seemed to
happy
work,
that
though. It worked for you.
I've got somebody here on Maui that is doing it, and I'm going to be seeing him a couple times a week, and we'll see how long it held. In Las Vegas, when he did it for me, he did it 2 days in a row, and it held for almost a week. So the nerves in the neck and the cranial nerves, I think he said something like 80% of the nerves in our body, all begin in the cranium, in the cranial nerve, and those things just get out of balance in some way, and this technique brings them back in there, and it only takes a couple of minutes. Anyway, that's my story this morning.
Well, I'm glad it worked. You
Yeah,
sound great. You're feeling good.
I feel good.
Ready to
I feel
talk to
good.
some people
Yeah.
today?
I am ready. Whenever
That's
you
great.
are, dear.
Yeah, we've got some